Hi, my name is Dr. Navneeth Kumar. I'm a consultant orthopedic and spine surgeon at Athreya Hospital. Physiotherapy is vital to both orthopedic surgery as well as spine surgery. I am an orthopedic and a spine surgeon, so I have my fair bit of experience with patients and their need for physiotherapy. But the role of physiotherapy is slightly different when it comes to orthopedics and in spine surgery. So, in orthopedic surgery, we manage a lot of patients with fractures and also arthritis patients. We do joint replacement surgeries, and patients with sports medicine we manage with arthroscopy. All the three patients, all the three different type of patients need physiotherapy in their post-operative period. So patients with respect to fracture, when you have a fracture of any bone in the body, your orthopedician is going to immobilize it so as to reduce the pain, swelling, and also aid with the healing, or he's going to operate it and fix it with either a plate or a screw. But invariably, what happens in all the cases is that the fracture is immobilized and one joint above and below the fracture is also immobilized. So the patient may completely heal from the fracture, maybe at 6 weeks or 2 months after the injury, but they invariably will have stiffness and pain in the joints close to the fracture. So that is where physiotherapy comes in. If there is, of course, in casting, we immobilize the patient for 6 weeks, we remove the cast and then deal with the stiffness, and then we refer them to the physiotherapist to bring about all the range of motions. But when we operate the patient, obviously this can be hastened. Okay, we can send the patient immediately after surgery. If the fixation is adequate and stable, we can send the patient immediately after surgery for good physiotherapy so that their outcome is good. And when it comes to knee replacement surgeries, osteoarthritis of the knee is one of the most common ailments we deal with. So patients with knee replacement, I would say physiotherapy is 50% of the healing or the rehabilitation. Surgery, yes, surgery is very important, but their patients' healing and recovery starts from the day of surgery. It is how well they adhere to the physiotherapy and how well they're able to bear with the pain and take up their physiotherapy sessions regularly. That will determine how well they recover and how quickly they are back on their feet doing their day-to-day activities. So arthroplasty, it is very important. And sports medicine. So sports medicine, we manage these ACL tears or shoulder dislocations where we have ligament tears in the shoulder. We manage it through arthroscopy. Post surgery, again, there is a heavy dependence on the efficiency of the physiotherapist to bring them back to their normal self. So there needs to be a focus on range of motion exercises and muscle building exercises, so that these individuals they come to us with sports. These individuals with sport injuries are classically youngsters who want to get back to their sports. They want to get back to their original level of activity and fitness. So after the arthroscopy surgery, the orthopedician refers to a physiotherapist, and it is their job to rehabilitate the patient faster. So as you can see, in all the three aspects of orthopedic surgery, trauma, arthroplasty or arthroscopy, physiotherapy plays a vital role. And now coming to spine surgery, spine surgery, the patients post spine surgery, no matter what the cause, it could be a degenerative spine or a traumatic spine injury. Physiotherapy is the most important tool to help the patient to help the patient get back on his feet the quickest way possible. So following spine surgery, the patient is bedridden. So there is an increased risk of deep vein thrombosis. Okay, the blood tends to clot in their legs. So this clotted blood can get dislodged and can get caught up in the lungs to cause pulmonary thromboembolism, which is a very dangerous, life-threatening complication. So as a spine surgeon, my primary focus in patients after surgery is to get them back on their feet. So classically, I would make the patient walk on the day one after surgery, and emphasize on the importance of ambulation and walking regularly in patients with spine surgery. So this aspect is given to the physiotherapist, where they focus on early mobilization of spine surgery patients, and they ensure that the patient does not develop any deep vein thrombosis or pulmonary thromboembolism. So it is very vital in spine surgery that we have a very good physiotherapist along who can help the patient recover faster. So, as you can see in both quadrants, that is orthopedic and spine surgery, physiotherapy is a pivotal role in the patient's overall recovery from the ailment. And I'm lucky to have a very good physiotherapist here in the Athreya Hospital. Dr. Nikhil Rana is the physiotherapist whom I work with, and we closely monitor patients, and we have a symbiotic relationship where we refer our patients from orthopedic department to the physiotherapy department and vice versa. So I would say physiotherapy overall is a part and parcel and a very important part of orthopedic care.